Hey everyone, and welcome back to the channel. Today, we're diving into a topic that's incredibly important, especially if you're over the age of 60 or if you have loved ones in that age group. Let me ask you a question. How often do you brush off a new ache or pain, thinking it's just part of getting older? While some changes are indeed a normal part of aging, ignoring certain symptoms can be a dangerous gamble. In fact, doctors frequently see cases where early warning signs of serious illnesses were overlooked, sometimes with devastating consequences. That's why today, we're bringing you a crucial video titled, Doctors Warn: 6 Deadly Symptoms You Should Never Ignore After 60. We're going to break down 6 key health issues that, if you experience them, should immediately raise a red flag and prompt a visit to your doctor. Think of this video as your essential guide to recognizing potential health threats early on. By understanding these symptoms, you'll be empowered to take proactive steps, seek timely medical attention, and potentially save your life or the life of someone you care about. We'll not only tell you what these symptoms are, but also briefly explain why they're concerning and what you should do about them. So if you're ready to take charge of your health and learn about these critical warning signs, stick around. And before we jump in, if you find this information valuable, please consider subscribing to our channel and hitting that notification bell so you don't miss any of our future health-related content. We also love hearing from you, so feel free to leave a comment below if you have any experiences or questions related to this topic. Let's get started. Symptom 1. Unexplained and persistent weight loss. Losing a few pounds unintentionally might seem like a good thing to some, but significant and unexplained weight loss, especially in older adults, can be a sign of underlying health problems. This is because our metabolism and body composition can change as we age. Several factors can contribute to this, including decreased appetite due to medication side effects or changes in taste and smell. However, more concerningly, unintentional weight loss can be a symptom of serious conditions like cancer such as pancreatic, stomach, or lung cancer, hypothyroidism, overactive thyroid, chronic infections like tuberculosis, or even conditions like depression or dementia that affect appetite and eating habits. In these cases, the body might be burning more calories than it's taking in due to the disease process itself. For example, cancer cells require a lot of energy to grow and multiply, leading to a depletion of the body's resources. Similarly, chronic infections can increase the body's metabolic rate. It's important to differentiate this from intentional weight loss through diet and exercise. We're talking about losing a noticeable amount of weight without trying. Let's say Mary, who is 68 years old, notices that her clothes are suddenly feeling much looser. She hasn't changed her diet or exercise routine, but over the past few months, she's lost about 15 pounds without trying. Her friends compliment her on her weight loss, but Mary feels more tired than usual. Initially, she dismissed it as just getting older. However, her daughter, noticing her fatigue and the significant weight loss, urged her to see a doctor. After some tests, Mary was diagnosed with early-stage stomach cancer. Because the weight loss was noticed and acted upon, her treatment started early, significantly improving her prognosis. This highlights how a seemingly positive change like weight loss can actually be a warning sign. If you notice that your clothes are becoming significantly looser, or if the scale shows a consistent downward trend without any changes in your diet or exercise, don't ignore it. Start by keeping a simple record of your weight over a few weeks. Note down any other accompanying symptoms like fatigue, changes in appetite, or digestive issues. Pay attention to how your clothes fit. If you're losing weight without trying, it's crucial to schedule an appointment with your doctor. Be prepared to discuss your recent weight changes, your typical diet, and any other symptoms you might be experiencing. Your doctor will likely perform a physical exam and may order blood tests or other investigations to determine the cause of the weight loss. Ignoring unexplained weight loss can delay the diagnosis and treatment of serious underlying conditions. Early detection is often key to successful treatment outcomes, especially in cases like cancer. By bringing this symptom to your doctor's attention promptly, you're taking a proactive step towards safeguarding your health. Don't wait for other symptoms to appear. Unexplained weight loss on its own is a significant enough reason to seek medical advice. Remember, it's always better to get checked out and find out it's nothing serious than to ignore a potentially life-threatening condition. Weigh yourself once a week at the same time of day, preferably wearing similar clothing. Keep a simple log of your weight. Pay attention to how your clothes fit. Are they becoming noticeably looser around the waist, hips, or shoulders? Ask your spouse or a close friend if they've noticed any changes in your appearance. If you observe a significant weight loss, generally considered to be more than 5% of your body weight over 6 to 12 months without any intentional effort, it's time to consult your doctor. While self-monitoring is helpful, it's crucial to understand that unexplained weight loss requires professional medical evaluation. Your doctor can assess your overall health, consider your medical history, and order the necessary tests to determine the underlying cause. They can then recommend the appropriate treatment plan. Do not try to self-diagnose or rely solely on online information. A thorough medical examination is essential to rule out serious conditions and ensure you receive the right care. Symptom 2. Persistent and severe headaches. While occasional headaches are common and often benign, persistent and severe headaches, especially in individuals over 60, can be indicative of serious underlying medical conditions. Several mechanisms could be at play here. One of the most concerning is a stroke or a transient ischemic ataxia, often referred to as a mini-stroke. These occur when the blood supply to the brain is interrupted, either by a blockage or a bleed. A sudden, severe headache can be a key symptom, often accompanied by other neurological deficits. Another serious possibility is a brain aneurysm, which is a bulge in a blood vessel in the brain that can rupture, leading to a life-threatening hemorrhagic stroke. The pain is often described as the worst headache of my life. Temporal arteritis, also known as giant cell arteritis, is an inflammation of the arteries in the scalp, neck, and arms, and it commonly affects people over 50. It can cause severe headaches, often accompanied by tenderness in the temples, jaw pain while chewing, claudication, and vision problems. Less commonly, persistent and worsening headaches could be a symptom of a brain tumor, which puts pressure on the surrounding brain tissue. Other potential causes include meningitis, inflammation of the membranes surrounding the brain and spinal cord, or even severe hypertension, high blood pressure. It's crucial to understand that while most headaches are not serious, the sudden onset of a severe headache, or a headache that is different from your usual pattern, especially if accompanied by other symptoms, warrants immediate medical attention. Imagine John, a 65-year-old retiree who has always had occasional mild tension headaches. One morning, he wakes up with a headache unlike any he's ever experienced. The pain is excruciating, located primarily on one side of his head, and it feels like a throbbing pressure. He also feels slightly nauseous and finds it difficult to look at bright lights, photophobia. Initially, he thinks it's just a very bad migraine. However, as the day progresses, he starts experiencing some weakness in his right arm and slurred speech, dysarthria. His wife, noticing these additional symptoms, immediately calls emergency services. At the hospital, doctors quickly diagnosed John with a stroke. Because his wife acted promptly, John received timely treatment that helped minimize the long-term effects of the stroke. This example highlights how a severe headache, especially when accompanied by other neurological symptoms, should never be ignored. If you experience a sudden, severe headache that is different from your usual headaches, or if a persistent headache worsens over time, it's crucial to seek medical attention immediately. Don't try to self-treat with over-the-counter pain relievers, especially if the pain is intense or accompanied by other symptoms. Pay close attention to any associated symptoms such as neck stiffness, fever, Vision changes: blurred vision, double vision, weakness or numbness in the face, arms, or legs, difficulty speaking or understanding speech, dizziness, loss of balance, or nausea and vomiting. If you experience any of these accompanying symptoms along with a severe headache, call for emergency medical help right away. Even if the headache is severe, but without other neurological symptoms, it's still important to schedule an urgent appointment with your doctor to rule out serious underlying causes. Ignoring a persistent and severe headache can have dire consequences, especially if it's a sign of a stroke, aneurysm, or other serious conditions. Delaying treatment in these situations can lead to permanent brain damage, disability, or even death. Early diagnosis and intervention are critical for improving outcomes. For instance, in the case of a stroke, prompt treatment with clot-dissolving medications can significantly reduce the extent of brain damage. Similarly, early detection and treatment of temporal arteritis can prevent vision loss. Don't underestimate the significance of a severe headache, especially if it's a new experience for you or if it's accompanied by other concerning symptoms. Act quickly and seek professional medical help. Pay attention to the characteristics of your headaches. Is it sudden or gradual in onset? How severe is the pain on a scale of 1 to 10? Where is the pain located? Are there any triggers you can identify? Keep a headache diary to track the frequency, severity, and associated symptoms. Ask yourself if this headache feels different from any headaches you've had before. Regularly check for any new neurological symptoms like weakness, numbness, or changes in vision. If you notice any significant changes or concerning symptoms, don't hesitate to contact your doctor immediately. While self-monitoring and awareness are important, a persistent and severe headache requires a thorough evaluation by a medical professional. Your doctor will take a detailed medical history, perform a neurological examination, and may order imaging tests such as a CT scan or MRI of the brain to rule out serious underlying conditions. They can then provide an accurate diagnosis and recommend the appropriate treatment plan. Do not attempt to self-diagnose or treat a severe headache. Rely on the expertise of your doctor to determine the cause and ensure you receive the necessary care. They may also refer you to a neurologist for further evaluation and management. Symptom 3. Shortness of breath or chest pain. Shortness of breath, dyspnea, and chest pain are critical symptoms that can indicate serious problems with the heart and lungs, particularly in older adults. Chest pain, especially if it feels like pressure, tightness, squeezing, or radiating to the arm, jaw, neck, or back, is a classic sign of angina or a heart attack myocardial infarction. These conditions occur when the blood flow to the heart muscle is reduced or blocked, often due to coronary artery disease. Shortness of breath can also be a symptom of heart failure, where the heart isn't pumping blood effectively, leading to fluid buildup in the lungs. Another serious condition is a pulmonary embolism, a blood clot that travels to the lungs, blocking blood flow. This can cause sudden shortness of breath, chest pain, and coughing, sometimes with blood. Lung infections like pneumonia or an exacerbation of chronic lung diseases like chronic obstructive pulmonary disease (COPD) can also cause significant shortness of breath and chest discomfort. Even conditions like anemia, low red blood cell count, can lead to shortness of breath due to the reduced oxygen carrying capacity of the blood. Given the potential severity of these underlying conditions, it's crucial to never ignore new or worsening shortness of breath or chest pain. Consider Robert, a 72-year-old who enjoys his daily walks. Lately, he's noticed that he gets winded much more easily than before, even after walking a short distance. He initially attributed it to getting older and being a bit out of shape. However, one afternoon, while gardening, he experiences a sudden, crushing pain in the center of his chest that radiates down his left arm. He also feels sweaty and short of breath. His wife recognizes these as potential heart attack symptoms and immediately calls emergency services. Robert is rushed to the hospital, where doctors confirm he has indeed had a heart attack. Because of the quick action taken, he receives prompt treatment that helps limit the damage to his heart muscle. This scenario underscores the importance of recognizing and acting upon symptoms like shortness of breath and chest pain without delay. If you experience new or worsening shortness of breath, especially if it occurs at rest or with minimal exertion, or if you develop any type of chest pain, seek immediate medical attention. Do not wait to see if it gets better on its own. If the chest pain is severe, feels like pressure or squeezing, radiates to other areas, or is accompanied by sweating, nausea, dizziness, or shortness of breath, call emergency services immediately. Even milder but persistent chest discomfort or increasing shortness of breath should be evaluated by a doctor as soon as possible. Be prepared to describe your symptoms in detail, including when they started, what makes them better or worse, and any other associated symptoms you might be experiencing. Ignoring shortness of breath or chest pain can have life-threatening consequences. Conditions like heart attacks and pulmonary embolisms require immediate medical intervention to prevent serious complications or death. Early treatment for heart conditions can significantly improve outcomes and reduce the risk of long-term damage. Similarly, prompt treatment for lung infections or exacerbations of chronic lung diseases can prevent respiratory failure. Don't dismiss these symptoms as just being out of shape or a minor ailment. They could be warning signs of a serious medical emergency that requires immediate attention. Pay attention to how easily you get winded during your daily activities. Are you finding it harder to climb stairs, walk short distances, or perform tasks you used to do without difficulty? Note any episodes of chest discomfort, including the location, intensity, and duration. If you have been diagnosed with a heart or lung condition, follow your doctor's instructions carefully regarding medication and when to seek help if your symptoms worsen. If you experience sudden or severe shortness of breath or chest pain, do not hesitate to call for emergency medical assistance. Shortness of breath and chest pain are symptoms that always warrant professional medical evaluation. Your doctor will perform a thorough physical exam, listen to your heart and lungs, and may order tests such as an electrocardiogram, ECG, blood tests, chest X-ray, or other imaging studies to determine the underlying cause of your symptoms. They can then provide an accurate diagnosis and recommend the appropriate treatment plan, which may include medication, lifestyle changes, or further specialist consultation. Symptom 4. Changes in bowel or bladder habits. Changes in bowel or bladder habits that are persistent and unexplained can be indicators of various health issues, some of which can be serious, especially in older adults. Persistent changes in bowel habits, such as new-onset constipation or diarrhea that lasts for several weeks, blood in the stool, a change in stool consistency e.g., very narrow stools, or a feeling of incomplete emptying can be symptoms of colorectal cancer. Other conditions like diverticulitis inflammation or infection of small pouches in the colon or inflammatory bowel disease IBD such as Crohn's disease or ulcerative colitis can also cause changes in bowel habits, often accompanied by abdominal pain and bloating. Regarding bladder habits, changes such as increased frequency of urination, urgency, a sudden, strong urge to urinate, pain or burning during urination dysuria, blood in the urine hematuria, or difficulty starting or stopping urination can signal problems like a urinary tract infection UTI, bladder cancer, or prostate issues in men, such as benign prostatic hyperplasia BP or prostate cancer. While some changes might be due to dietary factors or medications, persistent and unexplained alterations should always be investigated by a healthcare professional to rule out more serious underlying conditions. Consider Margaret, a 70-year-old woman who has always had regular bowel movements. Over the past few months, she's noticed that she's become increasingly constipated, and she's also seen small amounts of blood in her stool on occasion. She initially dismissed it as a minor digestive issue. However, her daughter encouraged her to see her doctor. After a colonoscopy, Margaret was diagnosed with early-stage colon cancer. Because the changes in her bowel habits were noticed and investigated promptly, her treatment had a higher chance of success. This illustrates how seemingly minor changes in bowel habits can be an important warning sign. If you notice any persistent changes in your bowel or bladder habits, such as those mentioned above, it's important to schedule an appointment with your doctor. Keep track of the specific changes you're experiencing, how long they've been going on, and any other associated symptoms like abdominal pain, bloating, weight loss, or fatigue. Be prepared to provide a detailed description of your symptoms to your doctor. For bowel issues, note the frequency, consistency, and color of your stools, and whether you've noticed any blood. For bladder issues, note the frequency of urination, any pain or burning, and the color of your urine. Ignoring persistent changes in bowel or bladder habits can delay the diagnosis and treatment of potentially serious conditions like cancer. Early detection of colorectal or bladder cancer significantly improves the chances of successful treatment and long-term survival. Similarly, timely management of conditions like diverticulitis or prostate issues can prevent complications and improve quality of life. Don't hesitate to discuss these changes with your doctor, even if you feel embarrassed or uncomfortable. It's a crucial aspect of maintaining your health. Pay attention to the regularity and characteristics of your bowel movements. Note any significant deviations from your usual pattern. Observe the color of your stool and urine, and be aware of any blood. Monitor how frequently you need to urinate and whether you experience any pain or difficulty. If you notice any persistent or concerning changes, make a note of them and discuss them with your doctor. Changes in bowel and bladder habits can have various causes, some benign and some serious. It's essential to consult with your doctor to determine the underlying reason for these changes. They can perform a physical exam, ask detailed questions about your symptoms and medical history, and may order tests such as blood tests, stool tests, urine tests, colonoscopy, or cystoscopy to reach a diagnosis and recommend the appropriate course of action. Symptom 5. Sudden weakness or numbness. Sudden weakness or numbness, especially if it affects one side of the body, can be a critical warning sign of a stroke. A stroke occurs when the blood supply to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. This can lead to rapid cell death and result in various neurological deficits depending on the area of the brain affected. Weakness or paralysis, typically on one side of the face, arm, or leg, is a common symptom. Numbness or a loss of sensation on one side of the body is also frequently experienced. Another potential cause of sudden weakness or numbness is a transient ischemic attack TIA, often called a mini-stroke. In a TIA, the blood flow to the brain is temporarily interrupted, causing stroke-like symptoms that usually resolve within minutes to hours. While the symptoms are temporary, a TIA is a significant warning sign that a full stroke may occur in the future. Less commonly, sudden weakness or numbness could be related to other neurological conditions like multiple sclerosis (MS), although the onset of MS symptoms is often more gradual. Nerve compression or damage can also cause localized weakness or numbness, but sudden, widespread weakness or numbness, particularly on one side of the body, is highly concerning for a stroke and requires immediate medical attention. Imagine David, a 68-year-old man, is having breakfast with his wife. Suddenly, she notices that one side of his face appears to be drooping, and when she asks him a question, his speech is slurred and difficult to understand dysarthria. He also complains of sudden weakness in his left arm and is unable to lift his coffee cup. David's wife immediately recognizes these as classic signs of a stroke and calls emergency services. Paramedics arrive quickly and transport David to the hospital, where he receives immediate treatment for an acute stroke. Because of the rapid recognition of symptoms and swift action, David has a better chance of recovery with less long-term disability. This example highlights the critical importance of recognizing the signs of a stroke and seeking immediate medical help. If you experience sudden weakness or numbness, especially if it affects one side of your body, seek immediate medical attention. Do not wait to see if it gets better. If you notice any of the following symptoms, even if they are mild or temporary, call emergency services right away. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. Sudden, severe headache with no known cause. Remember the acronym FAST. Face drooping, arm weakness, speech difficulty. Time to call emergency services. Even if the weakness or numbness resolves quickly, as in a TIA, it's still crucial to see a doctor immediately to assess your risk of a future stroke and receive appropriate preventative treatment. Recognizing and acting quickly on the symptoms of a stroke is absolutely critical. The sooner treatment is initiated, the greater the chance of minimizing brain damage and long-term disability. In the case of a stroke, time is brain, meaning that every minute counts. Prompt treatment with clot-dissolving medications or other interventions can significantly improve outcomes. Ignoring sudden weakness or numbness can lead to severe and permanent neurological deficits, impacting your ability to move, speak, think, and perform daily activities. Don't delay seeking help if you or someone you know experiences these symptoms. Be aware of any sudden changes in your strength or sensation. If you experience any weakness, try to assess if it affects one side of your body more than the other. If you notice any numbness, try to determine the location and extent of the numbness. If you live alone, consider having a plan in place for who to call in case of an emergency. If you notice someone else exhibiting these symptoms, encourage them to seek immediate medical attention or call for help yourself. Sudden weakness or numbness requires immediate professional medical evaluation. Doctors in the emergency room are equipped to quickly assess for stroke and initiate appropriate treatment. They will perform a neurological exam and may order imaging tests, such as a CT scan or MRI of the brain to confirm the diagnosis and determine the cause. Following a stroke or TIA, you will likely need ongoing medical care and rehabilitation to help you recover and prevent future events. Symptom 6. Persistent fatigue. Feeling tired occasionally is a normal part of life, especially as we age. However, persistent and overwhelming fatigue that doesn't improve with rest and interferes with daily activities can be a symptom of various underlying medical conditions in older adults. Several mechanisms can contribute to this. Heart disease, including heart failure, can lead to fatigue because the heart isn't pumping blood efficiently, reducing oxygen delivery to the body's tissues. Anemia, a deficiency in red blood cells, also reduces oxygen carrying capacity, resulting in fatigue and weakness. Kidney disease and liver disease can cause a buildup of toxins in the body, leading to fatigue. Certain types of cancer can also cause significant fatigue, often due to the cancer cells consuming the body's energy resources or due to the body's immune response. Depression is another common cause of persistent fatigue in older adults, often accompanied by other symptoms like changes in mood, sleep, and appetite. Other medical conditions like thyroid disorders, diabetes, and chronic infections can also manifest as persistent fatigue. It's important to differentiate normal tiredness from fatigue that is severe, persistent, and impacting your quality of life. Consider Eleanor, a 75-year-old who used to enjoy gardening and socializing with friends. Over the past few months, she's felt increasingly tired, even after a full night's sleep. She finds it difficult to get out of bed in the morning and lacks the energy to do the things she used to enjoy. She initially thought it was just part of getting older. However, her persistent fatigue started to worry her, especially since she had no other obvious reasons for feeling so tired. She decided to see her doctor, who performed some blood tests levels and discovered that Eleanor had an underactive thyroid hypothyroidism. Once she started treatment with thyroid hormone replacement medication, her energy levels gradually improved, and she was able to return to her usual activities. This example illustrates how persistent fatigue can be a symptom of an underlying medical condition that can be effectively treated. If you experience persistent fatigue that is significantly impacting your daily life and doesn't improve with rest, it's important to consult your doctor. Keep track of when the fatigue started, how severe it is, and any other accompanying symptoms you might be experiencing, such as changes in weight, appetite, sleep patterns, mood, or any new aches or pains. Be prepared to describe your fatigue in detail to your doctor, including how it affects your ability to perform daily tasks. Think about what activities you used to enjoy that you now find difficult due to lack of energy. Ignoring persistent fatigue can prevent the diagnosis and treatment of underlying medical conditions that may be contributing to it. While sometimes fatigue can be due to lifestyle factors or normal aging, it can also be a sign of a serious health problem that requires medical attention. Identifying and treating the underlying cause of fatigue can significantly improve your energy levels, quality of life, and overall health. Don't dismiss persistent fatigue as just being tired all the time. It's a symptom that warrants investigation by a healthcare professional. Pay attention to your energy levels throughout the day. How often do you feel tired or drained? Does rest help improve your fatigue? Are you finding it difficult to perform your usual daily activities due to lack of energy? Keep a simple log of your energy levels and note any patterns or triggers you might identify. Also, consider if you have any other symptoms accompanying your fatigue. Persistent fatigue can have numerous underlying causes, and it's essential to consult with your doctor for proper evaluation and diagnosis. Your doctor will take a thorough medical history, perform a physical exam, and may order blood tests to check for conditions like anemia, thyroid disorders, kidney or liver problems, and diabetes. They may also ask about your mood and sleep patterns to assess for depression or sleep disorders. Based on their evaluation, they can determine the cause of your fatigue and recommend the appropriate treatment plan. Remember, the key takeaway here isn't to become overly anxious about every little ache or pain. It's about being aware of significant changes in your body and understanding when a symptom warrants a visit to your doctor. Early detection and intervention can make a huge difference in the outcome of many serious health conditions. We strongly encourage you to take these warnings seriously. Don't hesitate to seek medical advice if you experience any of these symptoms, especially if they are new, severe, or persistent. Your health is your most valuable asset, and being proactive about it can significantly improve your quality of life and longevity. We understand that talking about health issues can sometimes be scary, but knowledge is power. By being informed and taking timely action, you're empowering yourself to live a healthier and longer life. So, please, listen to your body, pay attention to these warning signs, and don't delay seeking professional medical help when needed. You deserve to enjoy your golden years to the fullest, and taking care of your health is the best way to ensure that happens. Now, we'd love to hear from you. Have you or someone you know ever experienced any of these symptoms? What was your experience? Feel free to share your stories in the comments below. It might help others who are going through something similar. If you found this video informative and helpful, please give it a thumbs up and share it with your friends and family, especially those over 60. This information could be life-saving. Thank you so much for watching. We truly appreciate your support. If you haven't already, please subscribe to our channel for more valuable health tips and information. And don't forget to hit that notification bell so you never miss an update. We're here to help you on your journey to better health. Until next time, take care and stay healthy.